Hey everyone, welcome back to the channel. If you've recently recovered from COVID-19 but are now feeling those familiar symptoms again, you might be wondering, why am I getting COVID again? You're not alone, and today we're breaking down exactly why reinfections happen, what it means for your health, and what you can do about it. So, let's start with the basics. When you get COVID-19, your immune system steps in and creates a response that helps protect you. That's why for several months after recovering, you're generally less likely to get it again. But here's the catch. That protection fades over time. And if you have a weakened immune system, your body might not respond as strongly or at all. This means reinfection is possible even just weeks after your last illness, though that's still pretty rare. Now, the good news is that most reinfections tend to be mild. Your body still remembers how to fight off the virus, which helps lower your risk of getting seriously sick or needing to go to the hospital. But there's another important factor to consider. The virus itself is always changing. New variants can show up that your body hasn't seen before. These changes can help the virus sneak past your existing immunity, making reinfection more likely. What can you do about it? This is where the CDC's recommendations come in. No matter how many times you've had COVID, using core prevention strategies is still one of the best ways to protect yourself and those around you. Here are a few simple but powerful steps. Stay up to date with immunizations. Vaccines help your body stay ready for whatever variant is going around. Practice good hygiene. Wash your hands regularly, cover your coughs and sneezes, and keep things clean. Take steps for cleaner air. Open windows, use air purifiers. Better airflow means less virus lingering around. If you're feeling sick or might have a respiratory virus, take precautions. That means staying home if you can, wearing a mask around others, and avoiding crowded spaces. And if you're at higher risk of severe illness, don't wait. Get tested and talk to your doctor right away. Early treatment can reduce your risk of getting seriously sick. Reinfections with COVID-19 are possible, and they're becoming more common. The virus keeps evolving. New variants may look different to your immune system, even if you've had COVID before or been vaccinated. Over time, the protection from past infections or vaccines can fade. That's why you might be more vulnerable to catching it again. The good news? Most reinfections are mild, especially if you've been vaccinated or had COVID before. But they can still spread to others, and there's still a chance of getting seriously ill. What symptoms should you watch for? So how do you know if it's COVID again? The symptoms can vary, especially with new variants, but here are some of the most common ones. Fever or chills, cough, shortness of breath or difficulty breathing, sore throat, congestion or runny nose, new loss of taste or smell, fatigue, muscle or body aches, headache, nausea or vomiting, diarrhea. And remember, symptoms might show up differently depending on your vaccination status or past infections. What to do if you feel sick? Feeling off and not sure why? Here's what to do. First, stay home and away from others, even the people you live with, if possible. It's important to prevent spreading the virus while you figure out what's going on. If you have symptoms that aren't clearly explained by something else, don't wait. Get tested. If you have risk factors for severe illness, like being over 65 or having certain medical conditions, seek medical care right away. Starting treatment early can reduce the chance of serious illness or hospitalization. How to stay protected? Even if you've had COVID before, it's still important to take preventive steps. Stay up to date with your vaccines. Practice good hygiene. Improve air circulation indoors. And take precautions when you're sick or around others who are. Section 5 Treatment Options you should know about. There are several FDA-authorized treatments available, especially for people more likely to get very sick. Let's go over a few. Paxlovid, Nirmatrelvir with ritonavir. For adults and kids 12+. Must be taken within 5 days of symptoms. Taken at home by mouth. Side effect. Sometimes causes a metallic taste. Veklury remdesivir. For adults and children. Must start within 7 days. Given via 4 at a healthcare facility for 3 days. Molnupiravir, Lagevrio. For adults. Start within 5 days. Taken at home by mouth. Every medication has possible side effects and drug interactions. So it's super important to speak with a healthcare provider before starting anything. What to expect at home? The good news? Many people can recover at home with rest, fluids, and over-the-counter medicine. Here are a few things that can help. Fever and pain relievers like acetaminophen, Tylenol, or ibuprofen Advil. Cough syrup for relief if you're congested or have a sore throat. Plenty of water, sleep, and healthy meals. If you're high risk, like over 65, have chronic health issues, or a weakened immune system, talk to your doctor about antiviral treatments. These can stop the illness from getting worse if you start them within a few days of symptoms. Taking care of someone else? If you're caring for someone else with COVID, you're not just a helper, you're a hero. Here's how to make sure they're okay and protect yourself. Help track their symptoms in case they get worse. Make sure they have food, meds, and anything else they need. Take care of pets if needed. Keep the space well ventilated and wear a mask if you need to be nearby. And if you're at higher risk yourself, it's okay to step back and let someone else take over if possible. Mental health during isolation. Isolation can be tough, mentally and emotionally. Whether you're the one sick or taking care of someone, it's easy to feel drained. Here are a few things that can help. Eat healthy. Get enough sleep. Try relaxation techniques. Call or video chat with friends and family. Do activities or hobbies you enjoy. Yes, binge watching counts. Taking care of your mental health is just as important as physical recovery. So if you're asking, why am I getting COVID again? Remember, it's often a mix of fading immunity, new variants, and how your own body responds. But there are steps you can take to stay safer. If you found this helpful, don't forget to like, subscribe, and share this video with someone who might be going through the same thing. Stay healthy, and we'll see you in the next one.